Hi, and welcome to the April edition of Advocacy and Policy with Arnold and Porter. I'm your host, Kevin O'Neill. Today, we're going to be talking about two major topics, the education policy sector as well as healthcare policy. To lead things off, we're going to talk about education policy. I'm joined by Amy Smith and Amy Davenport, two policy advisors here at Arnold and Porter. So this topic in the education space is maybe something people don't know a lot about or hear much about, but it's part of a pretty important regulation in the education space called cash management. Boy, I wish I could speak straight. Cash management. So tell me a little bit about what cash management regulations are and what's going on right now.
Yeah, thanks, Kevin. You know, it's a little known part of the regulation, but it's really an important part of how financial aid is dispersed and distributed to students. There's a whole set of regulations governing how institutions take in federal financial aid and then give that money back out to students to use it for their classes, for books and supplies, for meals on campus, room and board. And these regulations really kind of set the tone for and lay out how these funds can go to students, how they can be used, when they can use them, how they can use them, and all of those different aspects of financial aid.
Gotcha. Well, tell me a little bit about, there's two programs, inclusive access and equitable access. Those sound like typical government terms that are hard to distinguish between. So what are they and what's the difference?
That's right. Depending on which campus you're on, you might call it a different name. I'll just refer to them as affordable access programs because generally through the cash management regs that Amy Davenport referred to in 2016 when these were rewritten, they allowed institutions of higher education to enter into non-exclusive agreements with publishers, so those who provide course materials, textbooks to college students, if they could meet a set of standards, which were they had to be provided by the first day of class, they had to be below market value, and students could opt out of the provision. And so these were changed in 2016 to allow that to happen. And really became widely popular on most college campuses. Again, they are referred to as different things, but generally as affordable access programs because they really have lowered the price of textbooks for the first time in over 100 years.
Interesting. That's a very interesting model. Anytime you're talking about lowering prices over time, especially in this inflation-driven world, you've got a lot of people whose ears perk up. So how many schools use this program and are there measurable outcomes the government is seeing that really are saving a lot of money?
Absolutely. So there's about 1,900 institutions of higher education that are using some sort of affordable access program like the ones Amy mentioned. There's a lot of stats out there about exactly how impactful these have been, both on the cost saving side, but then also on the outcomes for students. On cost savings, one student watch report found that over the last couple of years, there was a 40% decline in textbook and course material prices overall. One company we've talked to has saved students, just this company alone has saved students $150 million per year. There's a lot of money that students are saving because they're getting these textbooks at below competitive market rates. And that is a really great thing for students when the cost of higher education is going up in all facets. This is the one of the few places where prices are actually going down. Not only on the price side are we seeing some really great outcomes, but we're also seeing outcomes for completion. So one of the big reasons why the Obama administration decided to change these regulations was because for students with financial aid, they were not getting access to their course materials at the same time that students without financial aid were. So if you're paying for your books or your parents are paying for your books, you can go to the bookstore at any time and get me your materials. For students on financial aid, they had to wait until their financial aid was dispersed and then go to the bookstore to get their materials. And so what that meant was they were often behind and didn't get their materials for several weeks. Now, we're finding that students are able to access materials on the first day. And what that's meant over the course of time is that there was one study that found there was a 21% increase for students that were completing their courses and getting good grades, getting passing grades compared to when students weren't in inclusive access or affordable access programs. So lots of data showing that these are really helpful programs, not only on the cost saving side, but also on the course outcome side.
So I I might have gone and bought my books before class started, but I probably didn't open them until well into that grading period, right? So it's not always when you get them as to when you use them. So you mentioned $150 million one company is saving, just as an example. And so, my antenna goes up because it means that the federal government's probably trying to mess this up, right? So I understand that the regulations are under review and that the Department of Ed is thinking about changing the way these programs work. And maybe that's not going to be for the betterment of the students involved.
Kevin, your antenna is up for good reason. They are. They're taking another look at this. And what department staff has said during the negotiating while they're rewriting these regulations was that they got some complaints from student advocates and consumer groups that these programs, these affordable access programs, just don't always work right for students on certain campuses. So the disclosures around how much their course materials might be kind of hidden in the tuition cost, so they don't get to see and shop around. Or that the opt-out process is so cumbersome that it's just difficult for students today to opt out of these programs. The reason the opt-out mechanism was so key back in 2016 was because that's what allows institutions and publishers to negotiate these bulk pricing agreements, right? So if you're able to leverage the economies of scale, the prices come down. What the department is doing is looking to get rid of that opt-out mechanism and change it to an opt-in mechanism, meaning that institutions cannot automatically charge. They need to have prior authorization from students or parents. And that's really going to drive down that economies of scale and the agreements between publishers and institutions to negotiate a price that really is more affordable.
Interesting. Okay, so one of my favorite terms I know is involved here, and that's neg reg, right? This is all part of a neg reg, a negotiated rulemaking. What does that mean, and where are we in that process?
Yeah, it's such a good question, Kevin, because the neg reg process it's a really unique way of regulating that is, the Department of Education is one of the few departments, federal agencies that has the authority to do this. And Congress has actually told the department, anytime you're regulating around federal financial aid, you have to use this negotiated rulemaking process. So Amy Smith mentioned, they've done their negotiations, which looked like 3 months worth of stakeholders from different parts of the higher education world coming together and talking about these proposals. And the department gets to put their proposal on the table, the negotiators discuss it, and then, hopefully they're coming to consensus. That's the goal at the end of the day. Unfortunately, in this instance, the department continued to put options on the table and proposals on the table that frankly, a majority of the negotiators in the room, particularly those from institutions of higher education, just couldn't live with. They weren't going to work. They're not going to save students the money that they have been saving under the way the program works. There were a lot of institutions that agreed to all the points that Amy mentioned about needing more transparency around pricing, making the opt-out mechanism a little bit easier to use. There were a lot of proposals saying, hey, let's fix some of these parts of the program that aren't working. Unfortunately, the department didn't really seem to be open to those changes. So what happens now, since all those negotiators didn't reach consensus, is the department gets to write the regulation as they see fit.
Sort of like negotiating with my wife. We get to negotiate right up to the point where she decides she doesn't like the answer, and then we do what she wants.
Yep, that's pretty much it.
That's how we're expecting this to go. It's unclear right now when the department will release its proposed rule, but it's in the process of writing the proposed rule. So they're taking meetings now with stakeholders to kind of keep informing their thinking on this. But based on what we've seen, the proposal that Amy was talking about around this changing the opt-out to an opt-in program seems like where the department is headed. We'll know more when they put out their proposed rule. Likely this summer is when we're kind of expecting it. It could be as late as this fall.
So it won't be this school year that we see the policy take effect if there's a change.
Correct. And the way that the Department of Education's rulemaking goes, this is also something set up by the Higher Education Act. Any rules that are finalized before November 1st go into effect for the following school year. So anything that's finalized by November 1st, 2024 will go into effect for the 2025-26 school year. So I don't see this as something, they would really have to speed up the process to get this in play for the 2025 school year. I don't see that as possible. And then there are some questions about, is this a 26 school year or even a 27, depending on how things move around, and also what's going to happen in the election. That could really shake things up if a different Department of Education picks this ball up in the middle of the game and runs with it and may run in a different direction.
Well, that's the policy answer to everything, right? Is the election can change. So the name of the show is Advocacy and Policy. We spent a lot of time talking about policy. Let's talk about the advocacy part. If you're a parent who's concerned about this, if you're a student, if you're a university concerned about this, and you want to be heard on the policy and the proposed changes, what do you do?
Well, look, if you're a student and you're concerned about your textbook or course material prices going up, you should really talk to your institution and make sure they're aware that you're concerned about this. Also, the Biden administration is really looking for the student voice. They've heard a lot about the other issues with the affordable access programs, not a lot from students who are concerned that their pricing will increase. So you should reach out to the Department of Education, as Amy mentioned, while they are in rule drafting mode. They want to hear from student advocates. They want to hear from parents. They certainly want to hear from institutions. As Amy mentioned, institutions put their proposal on the table during the neg reg process and are hoping that that's still an option before the draft rule comes out. Tell your friends if you are part of a student organization on campus, get organized, call your member of Congress. Members of Congress have started paying attention to this issue and just asked Secretary Cardona about it in a recent oversight hearing on Capitol Hill. You have the next few months to make an impact.
Very good. Well, if you want more information, you can hit up the Amy's at amy.smith@arnoldporter.com and amy.davenport@arnoldporter.com. All right, for our next segment here on Advocacy and Policy, I am joined by two of my colleagues, Senior Policy Advisor Sonja Nesbit, Managing Director Bobby McMillin, both resident in our healthcare policy group. And we're going to talk a little bit about what's happening in the halls of Congress in the healthcare policy world. So Sonja, Bobby, thanks for joining us today. Since we were last together on this podcast, Congress finally got its act together and finished the fiscal year 2024 appropriations process a mere 5.5 months late. And in getting that train to the station, there were a lot of passengers left behind. And one of the things that seemed like it was left behind was a real bipartisan effort to put some healthcare reforms on that. Tell us what was in that effort and why did it get left behind?
Yeah, no, it had a range of reform policies. The biggest one being for pharmacy benefit managers, the PBMs. They're sort of the middlemen in the pharmacy landscape between pharmacists, hospitals on one side, and manufacturers on the other. And that they haven't been very popular, frankly, on Capitol Hill over the course of the last year. So there were a lot of efforts to sort of examine their role, bring some additional transparency to some of their pricing decisions, things like that, in both the government markets and Medicare and Medicaid, and also the commercial space. And some of the reforms to the commercial space that were being proposed were one of the things that really kind of tripped things up at the end. On the GOP side, there's a lot of people that say, we can have some government intervention and oversight in the government programs. When it comes to commercial, that's sort of a bridge too far. That's two independent actors, and government doesn't have a role there. So that was one of several hangups. Another was there was a big pandemic preparedness bill that was supposed to ride along there. It's sort of like the ink blot test from the pandemic, right? Republicans view the pandemic and lessons learned entirely differently from the way that Democrats do. So there were some sticking points. They did reach probably 98% of the agreement very late in the process. But at that point, it kind of became a vote counting exercise. And it was kind of, for House and Senate leadership, you're bringing me this package late. It doesn't necessarily add votes. Why is it going to ride? So when you have something that's not must pass like that, it's a nice to have, not a have to have. If you don't kind of get all your ducks exactly in a row in plenty of time, then it's going to get left behind. Unfortunately, that's what happened here. Also some hospital issues that sort of got in the way too, in terms of how hospitals are reimbursed for services that aren't necessarily performed in that hospital setting. So all those things are still going to continue to be negotiated. There's still a lot of interest in getting some of these reforms done. It's probably just going to be in an end of year package. A lot of these reforms generate some Congressional Budget Office savings, and you know how popular those can be.
Savings? I didn't know the federal government could do that. I thought they were only spenders.
Every now and then. Sonja, what did I miss?
No, you got everything. That's exactly right. We see this as a year-end item. I've been talking with folks on the House and the Senate side. To Bobby's point, a lot of these programs and these policies themselves have bipartisan support. They were 98% there. The question just becomes when it happens and when there's an appetite to get it done. Now, of course, the elections aren't really helping anyone, right? Because everyone's waiting to see when the dust settles, particularly in the Senate, to see who's going to be up and who's going to be down. And so, again, I'm hearing directly from folks that they anticipate things to happen once that dust clears in November.
I don't know. It's inconceivable the election is driving prescription drug usage in some contexts, right? I mean,
certainly at my house.
yeah, exactly. So, okay, one of the things I know that was out there in the negotiations is a complex and obscure program called 340B.
Yes.
What was that about? All about that, and where is that going?
I don't know if it was part of the negotiations in the most serious form. 340B is a very complicated program, as many of these listeners know, and one of which there's a great deal of desire to do something towards it. But when we get to the political will of getting something over the line, it gets a lot more complicated than that. But there are a lot of things that are happening in this space, particularly with legislation that was introduced by two ENC members. Doris Matsui from California introduced a bill that would codify contract pharmacies in the 340B program. Larry Bouchon introduced a bill that would provide greater transparency and clarity in the program, so that you have a better sense of what's happening there, how the money that's being saved from the program is reinvested into it. And then there's also, and we talked about this on another podcast previously, the administration dealing with the case that they got that didn't help them any with the Genesis versus Becerra related to the definition of a patient for the purposes of participating in the 340B program and applied to one particular entity, healthcare system. But as you might imagine, every other healthcare system is now salivating to see what might happen if that decision can be expanded to apply to them as well. So far, the administration hasn't appealed it. We don't know what they're going to do, but we do know that, again, 340B weighs very heavy in this world. In fact, one former colleague who works in this space in the administration, they call it, basically, I think it was the program peeking from behind the door. It's a very difficult thing to advance, and they have to figure out if they're going to win in court. Now, of course, if you're on the other side, on the congressional side, you're kind of waiting to see what's happening there as well as trying to figure out how to leverage your bets and moving forward as well. Bobby, what do you think?
Yeah, no, I mean, this is such an interesting issue, right? Because it doesn't break down along traditional partisan lines. And you can sort of see the Senate working group that's working on this. You've got some rural Republicans aligned with Democrats, and really your constituents on this on the Hill are sort of divided into one of two camps. There's someone who thinks that the intent of the program is exclusively to help low-income indigent patients. And then there are people that see these as, frankly, sort of propping up hospitals. And they don't really apologize for that position. These are jobs programs if you're in a rural state. You need those hospitals' doors open, but I think a lot of manufacturers would say this has sort of grown beyond what was originally contemplated. And you mentioned the Genesis case and the patient definition. There's a lot of litigation too about contract pharmacies, and it's one thing for a hospital to be distributing these 340B drugs from their own in-house pharmacy. It's perhaps another to contract with dozens or more. Is that really what the program is? There's a lot of concern among manufacturers about duplicate discounts with Medicaid patients and 340B patients and those drugs getting double discounted. So the Senate working group is an effort to address that. It's pretty late in the year, and for a Senate product to move, Senator Sanders is going to have to prioritize this when it's something that getting a balanced product is it's really tough to do for all the sticky reasons you mentioned earlier. So we'll see. I think it's certainly going to help advance things this year. Two of those Senate members, Senator Cardin and Senator Stabenow, are stepping down this year. So this is sort of it for them, and probably unlikely that something gets enacted. But I think the conversation is going to continue to advance. You mentioned some of the work that Rep. Bouchon's doing on the House side. So probably a situation where we're teeing things up more for 2025.
No, I think that's right. And I'm glad you mentioned the Senate working group, because I do know that the administration is actually informally chatting with them as well, right? So they're looking at these policies. They're even looking at bills in the House and deciding whether or not there are things that they can live with if they were to be passed. But a lot of the things that you brought up related to duplicate discounts and all the other issues related to how the program has expanded, how folks are getting these medications that are not necessarily within the pharmacy, and how the definition of a patient is determined, makes it, to your point, super duper sticky. Because as much as I think folks have there's a consensus that there needs to be some boundaries on a program. I've talked to Democrats who would throw their bodies in front of that bus if they thought, oh my God, my rural hospital system would be disadvantaged. But at the same time, there are a lot of healthcare systems that are huge and prosperous who are also participating in the program.
Yeah. Well, and there's been a lot of media coverage about people, making some creative use of the 340B program and not necessarily benefiting some of those implications, right?
So couple of things there. You really talked about the complex interplay between what Congress is hoping to do, what the administration is trying to get Congress to do, and how court cases sort of weigh on that. So one of the other big developments of the last couple of years, the Inflation Reduction Act, which has some mandatory drug pricing provisions in there that give the government pretty big, Teddy Roosevelt, a big stick to walk with, right? And some of the drug companies have sued over that. But in the meantime, these forced negotiations are going on. How's that rollout going, and what does it mean for the policy process?
So, litigation's ongoing, several different court cases. I think the Hill's not necessarily too fixated on that right now. You still have people kind of too firmly in their own camps, frankly. There's been a few really smart bills introduced that would tweak some of the drug pricing provisions from the IRA in a way that I think, it would drive innovation and the way that both Republicans and Democrats say they want. I think it's just it's very early. Sonja, I'd be really interested in your thoughts here for Democrats to have an appetite to revisit this law when the ink in their mind is barely even dry.
No, I've talked to a number in leadership and others who are on committees of jurisdiction, on health jurisdiction, as well as rank and file members. I mean, to your point, well, let me just step back and point out, I think, the obvious, as she checks her notes here, that this is landmark legislation, historic legislation, for better or for worse, and obviously one of the legacy items that the Biden and Harris administration will champion for years. And so when you have, and you all know this, you have this transformative policy everyone's proud of, you're not going to do a lot to go out there and perhaps tweak it or for what Democrats would say, sort of on day one. You hear a lot of it just got passed, it's being implemented. Let's see how things work out in the next 2 to 3 years. I've also heard from someone in the House leadership that, look, the reality is that there's never been a bill that's this large that's been passed without any adjustments made over time. The questions become, though, in order to have informed decisions about how to make those adjustments, we have to see how it's implemented. Now, there are some areas that desperately need to be tweaked right now, and I think some members will concede that. Somewhere between some and most would concede that. But at the same time, I do think there's a little reticence about opening up right now, because once you do that, my gosh, where does it stop from their perspective? And also, does opening it up right now undermine the credibility of the bill in terms of helping Biden get reelected?
On the flip side, aren't there some Dems who want to take what was in IRA and basically say, was it 20? No, not 20, 100. Like they want to blow it open, right?
That's absolutely right. And I'm told once those tweaks do take effect and when that discussion happens about the tweaks and when it takes effect, we can expect more to happen. There would be more drugs to be subject to negotiation. There would be greater just expansions of where they're at. They feel like the IRA very much was a compromise to where they wanted to be. So,
and Republicans don't feel like it was a compromise.
Nor do manufacturers, right? Drug manufacturers.
No, that's right. No, I think most Republicans are thinking about this, and I guess presenting it in a way that I think is pretty smart. There was a big rare disease hearing at Energy and Commerce at the end of February during Rare Disease Week. And so 3 of these bills were discussed and really brought up in the context of what's the impact for rare disease patients. There's going to be less drugs developed. You can argue about how many fewer and whether or not the trade-offs are worth it, but there's going to be less drugs for rare disease patients. And so I think the E&C committee did a good job really highlighting that. But yeah, I think you're exactly right, Sonja. And it's the way, some of my old counterparts on the Hope Committee used to negotiate, right? If okay, maybe there's these 3 changes that you want, and there's a good case to be made for those. Now we want this other thing if you're going to get that. There's going to be some horse trading. So even if you get those 3 things, the trade may not be worth it in the grand scheme of things. Always a fun exercise.
And I've heard this from members, and we've seen it from the administration's actions. It's funny how transforming that policy is and how everyone in D.C. is talking about it. But back in, real America, as I like to think about it, most folks don't know any of this right now. I was chatting with a member yesterday who has a mom who's on insulin. She came home and told guess maybe a few weeks ago, hey, my insulin bill went down from $200 to like $35. That's amazing. How did that happen? He's like, Mom, I told you.
That's what I do for a living, Mom.
It's what I do for a living. But so the administration, as we're also dealing with this pressure to amend and also deal with court cases, they're also dealing with a gap, I think, in the ability to translate their success and talk about it in the way that voters see it right now.
That's an incumbent with a real re-election problem. If he hasn't even gotten Mom to hear what his accomplishments are.
I'm so confident in this incumbent in this case he's listening, so we're all good.
Yeah.
Kevin, just super quick and not to get too far into what 2025 might look like.
Yeah.
A lot of time to think about that, but worth talking about that President Trump is resurrecting his most favored nations proposal in some form or fashion. I think when you talk to some of his former health staffers, they're thinking about it maybe a little bit narrower than the proposal that was released at the end of the administration. But, it's just a reminder that this isn't necessarily a partisan issue, that while they may go about it a different way with the IRA and its more formal negotiation process, it seems like the Trump team is thinking about how they might come for their pound of flesh as well.
That's a brilliant point.
Yeah, that is a good point. So one more question is, tell me a little bit about the BIOSECURE Act, because that is also something on the minds of many policymakers right now.
Yeah, the BIOSECURE Act has been frankly taking up a lot of folks' time on the Hill, and I think stakeholders trying to absorb what it means. It's a bill that's been introduced in both the House and Senate. Essentially, it would bar activity with 4 listed Chinese companies. But on the part of the federal government, which is most people can sort of say, okay, at that point, that's essentially like no NIH grants for these 4 companies, right? But there's a second piece of it, which would prohibit contracting with people who contract with those entities. And there's differences in scope between the House and Senate bill now.
It's like the Kevin Bacon game.
That's right. There you go. Love that. So I think people are really trying to absorb, because some of these companies are major suppliers, research manufacturers for lots and lots of U.S. pharmaceutical manufacturers. So I think
2 degrees out, you catch almost everybody.
That's right. And I think it's probably just 1 degree out, but still you're catching everybody at even 1 degree. So what does that look like? Is it going to move forward? What's the scope of the services that would trigger the bar, if you will? And is there an appeals process or waivers and things like that? And can we grandfather current provisions? It seems like, so the Senate, when they moved the bill, included some grandfathering language, tighten a little bit of the federal contract nexus, so that it's not, a bar for doing almost anything anywhere. It's a little bit tighter in its U.S. relationship. I think there's still a good bit of heartburn on the part of U.S.-based manufacturers about how this is going to play out. Okay, maybe they can live with it, with the grandfathering that at least doesn't totally disrupt what they're currently doing. But there's a lot of sort of terms that aren't entirely defined in the bill, and that's going to be up to the Office of Management and Budget to essentially issue guidance and regs on implementing that. Depending upon what happens in November, that could be a very different Office of Management and Budget.
Depending on what Congress or what the Supreme Court might say about the major questions doctrine, it also may be that OMB doesn't get to define those things. Congress may ultimately have to go back and do that. So the name of the show is Advocacy and Policy. We've spent a bunch of time talking about policy. You guys at the start said, hey, we got 98% of the way there. We're 2% away from getting a lot of the things across the finish line. We expect that that'll be end of the year. So tell me about the advocacy piece. If you're a player interested in these subjects, what are you going to do on the advocacy space between now and the end of the year to impact those conversations?
Sure, I'll jump in here. And Bob and I chatted about this a little earlier, and I chatted actually with a couple of members last night, but certainly one on this very subject. Right now, you are very much on the Hill, educating folks, talking to your hired consultants who are helping to position you so that when something moves, right now we have a lot of time between, when we finally got the last appropriations bills done for the last fiscal year until the elections, and not a lot's going to happen between now and then. We've already seen, particularly on the House side, on the Democratic side, frankly, folks going back to their corners and saying, you know what, we have our positions, we're ready to talk when we can talk, but right now we're really focused on November. We're seeing the White House be very deliberate in these next few weeks in finalizing and releasing rules on a variety of things, particularly in the healthcare space. There's a thing called the Congressional Review Act that's coming up, and that window starts to open up towards the middle or the end of May. And so we're seeing a lot of aggressive activity out of the administration to get those regs out of the door now. So that's just all to say that a lot is happening in terms of finalizing rules. If I am anyone who is thinking about how to position myself for success whenever something moves at the end of the year, I'm on the Hill reminding people about the importance of what I do. I'm talking to my trade associations. I'm talking to my hired consultants and making sure that we're ready to go. Everyone knows what we need, why we need it, and there's no question that when we have that small space between that lame duck period and the end of the year, that I'm at the table.
Yeah. No, I think that's all super smart. We have divided government right now. It's more likely than not that we're going to have divided government this time a year from now. So I think
the good news is it can't be any more divided than it is now historically.
Don't say that. I think we've probably said that in the past. So,
but that said, I think regardless of how you're doing it, you want to make sure that you're talking to people in both parties, that you have people that can speak that language very well. And to Sonja's point, I think right now it is a lot about education. There's going to be probably an end of year healthcare package, but a lot of these items are for 2025. And you may say to yourself, well, we can wait till then. And there's a very good chance you start missing trains. You need to have your bag packed. You need to have that ticket in hand. And
so we're
those
back
trains
to our
could
train
show up
analogy
any day.
at the start.
That's right. Yeah, that's right. Just bringing it home for you, Kev.
Very good. Well, want to thank Sonja and Bobby. If you're interested in getting more information on these subjects, you can reach out Sonja.Nesbit at arnoldporter.com. Bobby McMillin, he would say that's with I's instead of A's in the McMillin. Bobby.McMillin at arnoldporter.com. And thanks for joining us today on Advocacy and Policy.